Why do I think my role with the Amyloidosis Speakers Bureau as a patient educator is so important to a medical education? It brings into play the patient's perspective. I describe my story of what went on prior to my diagnosis. It was a time of tremendous anxiety, depression. When I was diagnosed, it also brought emotions with that, the gravity of the situation, actually the relief of knowing now we had a diagnosis, what I had. So my role is to bring this whole patient perspective in so that medical students, you get the clinical side, but you also get the humanity side of it.
To me, the patient educator provides a unique educational experience for our students that has transformative effects on each of the students because they really get to hear about the disease from the patient themselves. As part of the educational program, we tell our students about the symptoms. We tell them about dyspnea and shortness of breath and chest discomfort and chest pain. But oftentimes, those lessons are somewhat of a generic educational experience for the students. But to hear from a patient themselves describe how incredibly fatigued they are just walking across the room, the shortness of breath that prevents them from sleeping comfortably, the authenticity of those experiences as expressed by the patient educator to the student takes all of that clinical content that has been provided and puts it into context for the student and really helps the student to move forward and be an efficient and excellent doctor.
Beyond bullet points and dry text, a patient educator brings humanity to the forefront. Patient educator gives the medical community an opportunity to see and to hear firsthand what it is like to have this disease, what it is like to go through sometimes years and many different doctors to get to a diagnosis, what it is like to be treated, and how hard it is sometimes, to stay hopeful and optimistic. It simply humanizes the condition.
I strongly believe in ASB because I cannot give didactic talk to the trainees, medical students, residents, and fellows with the same impact that a patient educator can have. The retaining capacity is much more when they hear the stories from the patients.
The message we are sending to our students through the patient educator is to continue to work hard on the patient's behalf, to continue to question, and to continue to explore until you've achieved the appropriate diagnosis and treatment, and not to give up or not to dismiss a patient or a patient's symptoms just because you don't fully understand them.
And I think it's very important for people being educated in the medical field to have that opportunity to meet sort of face to face with the person who has the disease, because nobody knows more about amyloidosis than the person with amyloidosis.